Hello there. So we just finished classes of teeth in the previous video. You haven't seen the previous video, please go and watch, then move ahead. Now we'll move to type of teeth. See, within each class you will see different type of teeth like incisors, premolars and molars. Further in incisor you will see two different types, central and lateral. Premolars have premolar first and second. Molars have first, second and third molar, right? You know as well. See, trait categories of teeth. Actually, a trait category distinguishes the characteristic, quality or attribute. Okay, so there are 5 trait categories: set trait, arch trait, class trait, and type trait, side trait. First, set trait. Set trait distinguishes the primary and permanent set of teeth, that is primary and permanent dentition. You know, there are 2 sets of teeth in human dentition, so primary and permanent dentition are there. So set trait distinguishes between primary and permanent dentition. How it distinguishes? Actually, if you differentiate primary and permanent teeth, then you will find primary teeth have bulbous crown and constricted neck, right? While in case of permanent teeth, proportionate crown and root ratio is there. Okay, one more thing, in case of primary teeth are whitish or milky white in color, while the permanent teeth are darker, relatively darker or yellowish in color because of the enamel. Enamel is transparent in case of permanent teeth, so you see the darker side, darker teeth, actually darker means yellowish color of the enamel. Okay, next, the arch trait. Just remember these things. This is the trait category. We have finished set trait, then arch trait, class trait, type trait and side trait. So second is the arch trait. Arch trait is distinguishing teeth in maxillary and mandibular teeth. Clear? Arch trait distinguish teeth in maxillary and mandibular teeth. See, there are 2 arches: maxillary, the upper arch; mandibular, the lower arch. So arch trait is distinguished. It's all about distinguishing. Okay, so trait categories are what? They are actually counting the differences between different categories, different set trait, different arch trait, different arches, different classes, different types and different sides, actually, if I summarize. So arch trait distinguishes the teeth in maxillary and mandibular teeth. Okay, maxillary and mandibular, how? For example, maxillary molars have 3 roots, and if you compare maxillary molar with mandibular molar, you will find maxillary molars have 3 roots and mandibular molars have 2 roots. Then class trait. Class trait is distinguishes 4 classes of teeth. Okay, you will find actually, you know that there are 4 classes as we have seen in the previous video. I am repeating it again. You just go and watch that video, then move ahead. Okay, and that is the part 2 of the chapter. See, class trait distinguishes the 4 classes of teeth. 4 classes are what? Incisors, canines, premolars and molars. Okay, so different classes, how the classes are different. For example, incisors have a straight incisal edge for cutting, canines have a single pointing cusp for piercing, and premolars are bicuspid and they help in grinding. Molars have 3 to 5 cusps. So this is the one example which distinguishes between different classes, actually. So this is the class trait. Next is type trait. Okay, now one more important point is there, cusp of cerebelli. Very often asked in Viva, cusp of cerebelli found in maxillary first molar. Cusp of cerebelli found in maxillary first molar. Okay, so remember this. It might be asked to you in your Viva, so do remember. What is this? It is a supernumerary cusp or an extra cusp. When you will study molars, you'll come to know what is the cusp of cerebelli. For now, just remember the cusp of cerebelli is present in maxillary first molar. Next, type trait. Type trait are distinguishing the teeth within one class. Okay, means in one class, like in central incisors, you will find central and lateral incisors are there. Central and lateral incisors are there. If you compare central and lateral incisor, see, this is the central and this is the lateral incisor. You can see clearly that central incisor have a straight incisor edge, while in lateral incisor the incisor edge is slightly rounded, right? Okay. Next is the side trait. Side trait is all about side, right and left side, like towards mesial or distal. Side trait, you will see mesial side closer to the midline or towards the midline, and distal side away from the midline. Clear? Next, coming to the next topic, which is the most important topic, because whenever you describe a teeth, you must have to write the name first. Okay, so do pay attention, because if you name the teeth correctly, then your answer will be marked correct. Okay, so how a teeth is named? Just teeth are named according to the set, arch, class, type, and side. Okay, set, arch, class, type, and side. Suppose you have to name this teeth. You have to name this teeth. Clear? How will you name this? How will you name this? First of all, you will have to tell the dentition. So it is the permanent dentition, right? Permanent teeth. Then you will have to say whether it is maxillary or mandibular. That is arch. Okay, then arch. And then you will have to say the class or quadrant. So right quadrant, left quadrant, right or left. And then you will say the type of teeth, whether it is incisor, premolar, or what. So it is an incisor. So for this teeth, if I name, it is permanent maxillary. Permanent is the dentition. Maxillary, this is the right side, right, and central incisor. Clear? So this is the trick. You just remember DAQT. So what we did, we just said the dentition, right, set, and then we said the arch, okay, maxillary or mandibular arch. Then we talked about the classes or quadrant, and then we said the type of teeth, whether it is central or lateral. So DAQT becomes the trick. Okay, so with this you can name the teeth. Clear? And then next topic is dental formula in humans. See, why do we need a dental formula in case of humans? Actually, dental formula, with the dental formula, we are able to differentiate human teeth, okay, from the other species. See, dental formula is used to differentiate human dentition from other species. And one more point here, it is number and type of teeth are represented by dental formula. Okay, obviously when you will be talking about a particular teeth, when you complete your degree, then you will obviously in your clinical practices, and you will have to name the teeth, or you will have to tell the teeth. So for this you need a dental formula. So number and type of teeth are represented by dental formula. Dental formula differentiate human dentition from different species, and also actually it is different for primary and permanent teeth. Okay, primary and permanent teeth. So for the primary dentition, you have the dental formula, incisors 2/2, canine 1/1. Now what is this actually? M2/2, 5/5. How will you read this? How will you remember? I know it is easy. You can learn it very well, very easily actually. See, I for incisor, C for canine, M molar. So you know that premolars are not in primary dentition. So how will you read it as? You will read it as incisors 2 maxillary, 2 mandibular, canine 1 maxillary, 1 mandibular, molars are 2 maxillary and 2 mandibular. So overall 5 teeth are there. So this is how in each arch you will see 10 teeth. Okay, overall 20 teeth in a primary dentition. Clear? Okay. Next is the permanent dentition. In the same way, you can write for the permanent dentition, the dental formula will be incisor 2 maxillary, 2 mandibular, canine 1 maxillary, 1 mandibular, premolar 2 maxillary, 2 molars. Here premolars are present in permanent dentition. Molars 3 maxillary and 3 mandibular. Overall 16 on each side. Clear? Next, stages of human dentition. See, in human dentition, there are different stages of the teeth. Initially, there is gum pad stage. When you usually you don't find teeth in a baby's mouth. So gum pad means the teeth are under the gum between 0 to 6 months. And deciduous dentition comes from 6 months to 6 years. Do remember the periods, and this is also a Viva question or a short note. Gum pad stage 0 to 6 months, deciduous dentition 6 months to 6 years, mixed dentition stage where it is also called as transition period, in which both the teeth are there, primary and permanent, 6 years to 12 years, and permanent teeth or permanent dentition starts from 12 years and beyond. Clear? Two more important points which are very often asked in Viva: neonatal teeth and natal teeth. Neonatal teeth are what? See, eruption of the central incisor in first 30 days is called as neonatal teeth. Okay, and natal teeth, obviously you understand, natal teeth means central incisors are present since birth. Okay, so this is the stages of human dentition. In the next video we'll talk about the macro and micro anatomy of the teeth, in which we'll see the crown have different elevations or depressions, root have elevation and depressions, what is anatomical crown and all anatomical root. Clear? So thank you. So guys, thanks for watching, and please do subscribe to the channel and press the bell icon for the next video. And if you find it useful, please like and share to the video. And if you have any query or any suggestion to the content of the video, please comment in the comment section, and you can DM me at Rathor Goddess. Thank you. Thanks for watching.